two different compounds. One is the THC, which is called as delta 9 tetrahydrocannabidiol, and the second one is the cannabidiol. It is termed as CBD. So one is the THC because it is reaching the brain in high quantities. It's also termed as the psychoactive compound, and the CBD is usually considered non-psychoactive because it does not reach the brain in substantial quantities. This is what is the generic way of telling it. But looking at the molecular level, what is the difference between the THC and the CBD in terms of its effectiveness is that the THC actually binds to the CB1 receptors as shown in the picture. It's a lock and key mechanism. It directly goes and fits into the receptor, and then a person will start having various effects ranging from relaxation, then he has altered sensation, that may be pain relief. They feel hungry and they start eating more, and after some time they sleep. So these are all some of the normal effects of THC. Again, it's a dose dependent effect, and if you take in more quantities, you start having euphoria, you will have hallucinations and things like that with THC compounds. The most important thing about the CBD is non-psychoactive. The question is why? If you can see in this picture, the CBD does not actually bind to the receptor just like THC, but it just goes and binds in a different area. And what it does is it does not allow THC to come and bind there. So that's the most important way of defining how the mechanism of CBD is. It modulates the receptor. It does not bind to the receptor. It just modulates the receptor, and basically it does not allow THC to come and bind. That's the reason why it is not having any psychoactive component to it. So which means the CBD can also behave in a certain way, and it has more of an anti-anxiety effect. It is shown to have anti-epileptic effect, antipsychotic effect. It also is a good pain relieving agent. It is more of an anti-inflammatory, and some studies are showing it is to be a neuroprotective agent as well. So the take-home message here is whether it is a THC or a CBD, the more likelihood of the drugs being developed is more likely to be a CBD-based compounds, just looking at the way it acts through a receptor. So the next question, what we want to ask is how cannabis is considered a medicine. Is it real? Is it based on the previous religious aspects, or is it proven to be scientific? So let's look at what are the effects of the cannabinoids. It's pleasure or relaxation, memory, coordination, pain control, appetite, or vomiting reflex. So, what medical problems do you think this can be helpful for? This is the most important question we actually take from all the historical aspects, and then moving forward is based on whatever it is showing, is there any benefit in terms of treating a medical disorder? So, some of the potential research which is conducted and has shown evidence, these are called as evidence-based medicine, is these products can reduce nausea, it can stimulate appetite. It has been shown to have a huge amount of pain relief is there. I'll come back to that later. It can control muscle spasms and pain, and it can reduce tics, and also it reduces convulsions. So these have scientifically been proven to be beneficial, and more importantly, without any adverse effects, not much of a severe adverse effects. So these are some of the ongoing clinical trials which are happening currently for the marijuana and marijuana-based medications. There's a huge list of medications. I've selected a few, but just to understand that the trend towards these medications getting into the approval stage or maybe into the market stage are high, considering the therapeutic potential of these compounds. So again, coming back, there are different kinds of cannabis-based medicine, which has been already discussed. One is the botanical cannabis, which is medical marijuana, or they call it as medical cannabis. So this is not yet approved anywhere in US or in other parts of the world, but still people are using it for various therapeutic benefits. We have synthetic derived medications, which are FDA approved in United States. One is the dronabinol. This is usually given for patients who have nausea and vomiting after taking chemotherapy for cancers. So these patients have extreme amount of nausea and vomiting, and dronabinol has been shown to be therapeutically useful for decreasing this nausea and vomiting. We also have nabilone, which is also again FDA approved for chemotherapy induced nausea and vomiting. And there are also these medications are also approved for anorexia associated with weight loss in patients with HIV infected patients or AIDS patients. So basically, here these drugs actually modulate the way the person eats food and how the energy is metabolized. So these are commercially available in US by prescription, and these are safe to take based on the reports what we have generated from a long time. Other medications which are not available in US but are approved elsewhere is navaximols. These are a combination of THC and cannabidiol. This is a mouth spray and it's useful for pain relief, muscle spasms. And currently, the FDA in United States is investigating its therapeutic benefits. And the other one is a remote Nabant, and these are used for obesity and nicotine dependence, and it's a selective cannabis receptor blocker. It's not a drug which goes and binds and activates; it just goes and blocks the activity, which I have not discussed in the previous slides. The last one is, again, I said in the previous slides, the trend towards looking at CBD based compounds is on a high scale, and there's a lot of diseases which has been investigated for its potential therapeutic effects. So one currently approved indication for the CBD is seizures for various three different types of seizures. One is the Lennox-Gastaut syndrome, Dravet syndrome, and tuberous sclerosis complex. So basically, this CBD component is beneficial for seizures, as I said, or any conditions where there is high activity of a cell or high activity of a neuron. These compounds are really beneficial. The advantage of CBD is that it is not psychoactive, so it does not induce any behavioral responses. The abuse potential is extremely low, so, and there are various research which has been conducted with CBT with respect to various other disorders which have been mentioned, ranging from cardiac, intestinal diseases, skin, as Dr. Murli mentioned, bone, and arthritic and neuropathic pain. And recently, there has been several observational studies to study various effects of these CBD compounds in neurodegenerative diseases like Parkinson's disease, Alzheimer's disease, multiple sclerosis, and so on. So the controversy again comes back to whether you use a medical marijuana or medical cannabis or THC or CBD based medications, and which is better among these two. This is the controversy which has been going on from past few years. So we just look at it, what are the pros and cons of these two medications. So the THC medications are also having psychoactive effects compared to the medical marijuana, or maybe even high because it's a restricted molecule. And these are chemicals in medical marijuana that moderate THC psychoactive effects. However, these chemicals are not present in the medications. Medical marijuana is cheaper, not made patented by any pharmaceutical industry. So these are some of the advantages of having medical marijuana or medical cannabis on one side. Smoked marijuana can give effects within minutes, whereas the medications take over a long time, maybe an hour or two. Instant feedback allows users to take more if needed for relief, and due to rapid relief, may consume less if smoked. So this again, I'm talking about some of the benefits of medical cannabis. When swallowed, THC absorption is more erratic and less concentrated. THC effects are more unpredictable and variable, and possibly less effective. However, the problem with medical marijuana is that it's not FDA approved. FDA approval assures that medications are effective, safe, and properly labeled. FDA cannot evaluate medical marijuana as a drug since it is derived from a plant and it's not a standardized medical formulation. Medical marijuana is different everywhere depending upon how it is bred, under what conditions it is grown, and various other factors come into play. There's no way to know if medical marijuana is pure. It can be contaminated by pesticides, mold, fungus, depending upon the region where it is grown and how well the quality is taken care. And it's always difficult to approve something which is smoked as a medicine. It has never, some of the negative effects of smoking can also be there, and depending upon the type of marijuana, it can undergo different types of chemical changes when burnt. There is no standardized measurement of the dose. Inhalation vary by individuals, unlike a constant way of taking pills. So, in a nutshell, the advantages of medical marijuana or cannabis is these chemicals that moderate THCs are psychoactive compounds. However, they are less expensive. We can give more immediate relief. Instant feedback allows for moderation, possibly less consumption, and less erratic absorption than THC medications. However, with the other side, which is the THC medications, these are FDA approved, meaning they are extremely safe, apart from a few side effects. These are standardized medical formulations. They are pure, they are not smoked, and they have a standardized dosing. And in the United States, according to the federal law, marijuana is still considered illegal, and that's the reason the hypothesis is that is marijuana can be still used as a medicine when it is illegal? That's the question we are trying to ask. So the last part of the question is Dr. Murli asked is this compounds toxic or non-toxic? So toxic by definition means that can it cause a death, whether it's an opinion or is it a fact. So the question is that it's a fact that it doesn't cause death by overdose, unlike a opioid, unlike other substance of abuse, which can cause direct cause of death attributed to these compounds. Cannabis has not even caused a single death as of now, just because of overdose. However, the point is here that it can cause death because of its indirect effects. It means that you consume cannabis and you start driving a vehicle, you go on it because you are actually in a kind of a sleepy mode, or you are with a group of people and you are trying to hallucinate, and then you try to jump from somewhere and fall and get killed. So these are the indirect effects rather than the direct. So these are one of the case where a person actually uh, fell to death after eating marijuana. He was actually hallucinating. He said that he can fly suddenly, and he went to a cliff and started to jump, and he died. So this is one of the case reports we have. So what could be the reason for this? Why it is considered non-toxic compared to other chemicals or substance of abuse is irrespective of whatever it does in the brain, different parts of the brain, whether it binds the cerebral cortex and causes altered thinking, causes impaired memory, or increased appetite, slow reaction time, or if there is loss of balance and incoordination when you consume, because it acts on certain regions of the brain which causes certain functions. The most important thing about this cannabis, whether it's an endogenous or a exogenous given compounds, is that this cannabinoid receptors, which I talked about in the previous slides, is not present in the brainstem. What does that mean is these brainstem is a region in the brain which is important for respiratory center and cardiovascular centers. So unlike, for example, a opioid, if you take in high amounts just to relieve pain, it goes and blocks the receptors in the brainstem, and when the brainstem dysfunctions, there is respiratory depression, cardiovascular instability happens, and the patient can eventually die because of an overdose. So that's part of the system which actually controls respiration and cardiovascular centers. In cannabis based medicines, the receptors for these compounds are not present or less scarcely present in brainstem. So there is no CB1 or CB2 receptors in the brainstem, and hence, even if you consume little bit of more dose, the patient might have different effects, but he will not die. That's the concept we wanted to tell. So the ending point here is it, irrespective of the dose, it is not going to cause a direct dose related death in an individual. So it can be still considered as a non-toxic depending upon the dose at which the drug is consumed.